This podcast is for entertainment purposes only and does not substitute for professional medical advice. Please seek a medical professional or healthcare provider if you're seeking any medical advice, diagnosis, or treatment. Thanks, everyone.
Hi, Patreon.
Happy Tuesday.
Yeah, well, for us, Patreon comes out on Fridays.
Oh, yeah, that's right. Happy
Friday.
Happy recording Tuesday. Happy Friday Patreon episode release day.
Yeah. Anyway.
Okay, I won't ever say that.
I'm just like, I'm going to go with
Happy
it.
day. Happy day.
You know, whatever day you choose to.
Yeah,
to
exactly.
do it. It just says the fact that you're here supporting us, we love you. So it doesn't matter. You do you, boo. We're here.
Exactly.
Know? So
we're actually here times two because we had a malfunction.
Mm-hmm.
We recorded an entire hour and something. And
the same episode that we're about to re-record now.
So, cheers.
Cheers to that.
Mm-hmm.
Yes, she just got out of work, came over so we could redo this thing and hope for the best.
At least it's an interesting episode.
I know, thank God. You know, at least it's not something very, I don't know. Anyway, first things first, we have an ongoing bet with the All About Nothing podcast with Barrett. And he said that, you know, he'd go ahead and plug us in if the Braids win.
Yeah.
And then if we, the Marlins, win, then you know, we'll return the favor. We're still talking about each other as I'm doing right now and as he did on his podcast episode, which you should go ahead and check that out.
So listen here, Mr. Barrett.
But let's see. If
there's one thing you need to know about
I know
us
nothing
Miamians.
about baseball right now.
No, listen, Julie, you don't need to know anything about baseball. What you do know already is that you're a Miamian. So what does that naturally make you?
Cuban from Miami.
Yes. What else?
Marlins fan?
Exactly.
Wade County?
Yes. Wade County. So we are automatically, it doesn't matter how much we suck, okay?
I know. It's
We will die hard for Marlins, the Miami Heat, and the Dolphins, baby.
What she just said, yeah.
All right, so game on, Mr. Barrett. Game on. Okay.
Mr. Barrett. Okay. But anyway, check out their podcast either way. But we'll see what happens.
Yeah.
It's on the 12th, right? You said?
Yeah, April 12th.
April 12th, we will find out who wins. But yeah, so we got that ongoing. And today's episode, jumping back on track, today we're going to be talking about.
You sounded like someone from Canada.
A spirit took over me or something. It doesn't. I don't make much sense.
All right, prions. We're talking about prions. The scariest thing, quite possibly in my dictionary of scary fears.
Yeah,
this is high up there.
Yeah, Evie has a special, not so special place in her heart for prions.
This.
I have it for toxoplasmosis, and you have it for this.
Yeah, toxo you can treat.
But it still remains dormant inside sometimes and you can't get rid of it and then it's feeding off of you. Prions is not feeding off of you, it just fucks you up and it completely
kills you.
100%. But toxo, it's feeding off of you. Like a little sneaky bitch.
Like a parasite.
Exactly.
Yeah.
You know.
like the parasite that it is.
Exactly. So that adds an extra thing that it's you're feeding off of me. Gross. Mm-hmm. You know, that's why. I think that's the main difference between this and that of why, this is horrible. This is absolutely horrific what happens to people with this. And we're going to get into
maybe
that.
for our year episode, our anniversary.
Coming up in June, guys.
I know, coming up in June. That's crazy that we've been doing this for a year. So we should have a list of our top 10 biggest.
Oh, 100%. Fears or episodes we've done so far.
That kind of fear-ish.
Fear-inducing.
Yeah, exactly.
At least for us. I know lobotomies was a good one for you.
That was terrible.
There were so many clips. I mean, the recording was horrible. We've come a long way since
Yeah,
the
we've come a
lobotomy
long
episode,
way.
but still, it was
But
a pretty good
lobotomy
episode.
was already like, we were already with our new program.
We were, but the picture quality, at least, of it.
Oh, yeah,
Anybody
yeah.
that sees it on YouTube, I mean, this is not great, but that was pretty bad. The video quality was shit, but the episode was real good.
I know.
I mean, this isn't great. This isn't a good production, but it's at least bright. That episode was dark. It was
Dark.
like
It
there
just,
was a lot.
It just went on theme.
Yeah, yeah.
It was on theme.
Made you squirm a lot with the
It's disgusting. Oh. Okay.
Anyway,
Anyways.
prions.
Yeah.
So what are prions?
Okay.
Prion
So
disease, better
yeah.
said.
So prions, it's also known as transmissible spongiform. Just the word spongiform
Yeah, it sucks.
already sucks for me.
Yeah.
Okay, spongiform encephalopathies, right? So for short, I'm just going to say TSCs on this episode. It's basically a family of rare progressive neurodegenerative disorders that affect both humans and animals, okay? So basically, they're characterized by long incubation periods, right? So they stay, just like toxo, dormant, just
Yeah.
stay there.
100%.
Okay?
Yeah.
They just
hate that.
stay in the system, not causing any symptoms, but they're there. Okay. And then the spongiform
So much.
changes in the brain. Okay. So these little prions, think of them like these little conglomerates.
coils.
Yeah. These little conglomerates that go and start changing your brain structures into more little conglomerates. So basically, the spongiform changes, right? And in the brain associated with neuronal loss and failure to induce an inflammatory response. So that's the other part that I hate about the prion situation is that the body has no idea what's going on. Everything is changing in your brain. It's taking over and your body's just like, oh, okay.
And it has no way of fighting with it because
It's your brain. That's the thing.
Exactly.
It's your
own
It's
stuff.
your own tissue that's being turned into something else.
It's rough.
You see, it's pretty
no,
bad.
it is. I agree.
So
100%.
the causative agent, okay, is believed to in prions is TSCs are believed to be.
You said that already.
Okay, yeah.
Yeah.
Okay, cool.
You said that.
All right. So, sorry.
Yeah, it's all good.
Okay. So prion disease is usually rapidly progressive and pretty much always fatal. It can be classified into several different types of prion diseases. So we're going to jump into that. Okay. All right, Jules. First one.
Yeah, this is what she's trying to do here. Okay, so forgive me. Creutzfeldt.
Good.
Okay, you see this? It's like, okay. Creutzfeldt-Jakob disease.
Jacob.
Fuck that.
I'm just kidding. I don't know if that's actually... I'm not sure if that's actually the way you say it. I just wanted to fuck with you.
No. At that point, it's
It's
like
actually Jacob. I'm not
like
I'm
her
not sure.
attending, at that time with the
Lennox
Gusto.
Festival.
Checking the other episode. I think it was the one before this one. I don't know. Previous episodes to this, and you'll know what we're talking about. But anyway,
Yeah.
Creutzfeldt.
Yeah, Creutzfeldt.
Creutzfeldt-Jacobs disease.
Yeah.
CJD.
Yeah.
The most common form of prion disease in humans, which can be inherited. So you could even inherit these, which is just awful anyway. Or it's sporadic. It just happens.
Yeah.
You know, bad lottery ticket at
Again,
that point.
more scariness.
Yeah, 100%. Developing suddenly without any known risk factors.
Yeah.
So there's a variant of this CJD, and it's an infectious type of the disease related to mad cow disease. So yeah, I definitely remember that. It was all over the news. People were
Disgusting.
not eating meat. People were freaking out, rightfully so. 'Cause
Rightfully
this is
so.
like death. Like this is death.
So
You know?
when I learned about this in medical school as a first year medical student, it was my first semester. Okay. First semester of medical school. We actually learned this in biochemistry, I guess because of the gene,
Yeah.
like you can have a gene mutation and causes the abnormal shape of the protein. But basically, I'll never forget that.
Scarred.
And yeah, it like scarred me. I turned vegetarian for like a very long time. And then the fear left. And then I was back to eating like all sorts of
Could have
animals.
eaten chicken or fish.
It's not safe, Julie. It's not safe. I don't trust anyone. And I don't trust prions. Who's to say that it only affects beef?
Science.
No, I'm just kidding.
No, but you have a point because fish is just plastic these days. Chicken is full of hormones, and then cows have Prion's disease.
Yeah, exactly.
So we're all fucked anyway.
Yeah,
And
exactly.
if you're thinking of other things, I'm gonna go down the list, and there's more things that have more other prions. So not just those three. But anyway, so continuing to that, and then this variant, the variant CJD, which is the one with the mad cow disease, is transferred through this contaminating meat, or even just the equipment that handles the meat
Yeah.
that has that infection. Okay. Gerstmann, Straussler, Schenker.
Yeah.
Okay. Syndrome.
Syndrome.
All of that. A rare early onset prion disease that typically affects individuals around age 40. So you're living a great, total, cool life, and then all of a sudden you hit 40, and surprise, this is your birthday gift for age 40. That's just.
And around 40, I mean, this could be even
You're right.
younger.
You're
you
right.
know?
You're right. Or after. You
Like
know,
right now, like I'm 35. I could
well,
potentially.
we're almost 35. Hold.
Yeah, I know.
Girl,
In a couple months.
hold on to that. Me even sooner than you. So we're holding on to that. Anyway, on the next one, fatal familial insomnia. This one's Yvette's favorite, which rightfully
the
so.
worst.
There's like a Netflix movie on this. Remember we spoke about it in
Yeah.
the previous first recording
Trial.
of this. Yeah. There's an actual, and again, I didn't even look up the name of it again, but there's a Netflix movie that's kind of, it's not this, but it's like a thriller.
Yeah.
That's gotta be based off of this because
Yeah.
it's exactly that. You can't fall asleep. And that's pretty much what it is. A rare the Spanish came out there. Hereditary disorder causing difficulty in sleeping. And we're gonna go more in depth on this one later. But pretty much you can't sleep, and that's what that Netflix movie was. Remember her? What's
Yeah.
her name? She's Hispanic too, and it was pretty much that. And she ended up having to be dunked in water, and then that was like the
Yeah.
cure to it. And you couldn't sleep, and you can't. If you can't sleep, you go nuts. So
Yeah. And
That's-
then like you just lose like all bodily functions of everything, and then that's it. But yeah, that one was like the most traumatizing to me. Like I'm a person that I cannot lose my sleep. So when I do lose my sleep, I'm terrible. And that's just like a couple hours I've lost sleep. I think about like my long newborn nights and those nights that I was like, I need to sleep. So imagine
yeah.
I mean, we're talking about days and days.
Well, they die
and days because they cannot sleep.
You know what it is? Dying because you don't sleep.
Yeah.
Mind blowing. Anyway, there's also scrapie, a prion disease in sheep.
Scrappy.
Scrappy.
Scrapey. Oh, it's scrapey.
It's scrapie? Oh, yeah. I was like, God damn it. Anyway. And then chronic wasting disease, which has actually been on the news these days because it's found in deer, elk, moose, and other types of cervids. So you see, guys, you're not safe from any meat. All these, they have it too.
Should have been a vegetarian.
I can't.
Me neither.
I can't.
I had a burger today. Again. I had a burger the first time that I was recording, and I had a burger today.
Ah, okay. Anyway, so prion diseases are caused by, like she said, the abnormal folding of a normal prion protein into an abnormal form. And when these clump together or they bind with a normal prion, this leads to the brain getting damaged, having the characteristic signs and symptoms of this disease. There are currently no known cures. All you could do is pretty much provide palliative care to ensure the comfort of the patient and all that. Of course, there's active research going on to this to develop more treatment and actually diagnostic tools to try to diagnose this earlier rather than later. And there's a bunch of those that I'm not going to bore you guys with it, but there is actual research trying to identify this and try to find a cure if at all possible. So we're going to talk a little bit more about the ones that I had just listed. Go right ahead.
Yeah. We're just going to be a little bit more in depth on what's actually happening.
Yeah.
So in CJD, the Creutzfeldt-Jakob. Okay. I'm kidding. I'm totally kidding. I'm tired. Okay.
Neither one of us is German, not even a little bit.
Yeah.
So
So is this German? Really?
I think it's German.
All right. Anyways, CJD. So again, very rare, but it is fatal. Okay. And then leads to rapid deterioration in movements, mental functioning. You can have basically brain tissue. The brain tissue that's affected can affect muscle coordination, thinking, and memory. So CJD is usually caused by the infectious prion. And then what happens is that when it starts infecting the other tissues in the brain, then that starts abnormally folding. So then that causes accumulation. And then when you have a lot of stuff, it's like you can't function, right? So you just have a ton of proteins abnormally folded, and then you cannot have that contact between neurons. So this causes irreversible damage. So the disease has several types, including sporadic CJD, which is the most common, and then familial CJD. So it can be inherited. Acquired CJD, including the variant CJD, which is mad cow disease or related to mad cow disease, or also iatrogenic. So iatrogenic is just like accidentally given to some.
Oh my God, that is horrific.
Yeah, I mean, if you think about it, like back then,
Yeah.
people didn't wash hands after surgeries or before surgeries.
You're right,
They
yeah.
didn't clean their tools appropriately.
Absolutely.
So you could have easily done a biopsy on someone and then given them when you were checking someone else.
Yep.
And again, so the symptoms of CJD is going to be pretty much the neurodegenerative ones. So that's going to be, it's a big spectrum of things, but it can include abnormal involuntary movements, impaired coordination, changes in your behavior and your personality, vision problems, and it can ultimately pretty much lead to death within a year. So once that starts happening, it's just like a cascade of things that kind of come along with it after that.
Oof.
So variant CJD is the fatal type of brain disease which is transmissible, again, prions, all right, like we had already said. It was first described in the United Kingdom in 1996, and it's commonly referred to as mad cow disease or human mad cow disease to distinguish it from BSE, which is its counterpart, okay? So variant CJD is caused by the prions, again, a misfold in the proteins, and then basically it's primarily spread through eating beef from cows that were infected with prions, okay? So for me, like, here's my thing. Yes, you can obviously be infected and all of that, but it like mainly affects your brain. Mm-hmm. So it's just like prions are just like hanging out in
everywhere.
Like the beef, and you just
it's everywhere.
It's disgusting.
I mean, it just once it gets it mainly affects your brain, but like it's just all over your body.
It's just all over, yeah.
Ugh.
So
and then also butchers, you don't have to eat it. If like let's say
you're just handling
you're
it.
a butcher and then you get cut
And
or
then you
whatever,
touch it,
or you like I don't know, touch your mouth or your eyes as you're butchering, and you know how many times we touch our faces and we don't even realize that we touch our faces.
Yeah.
So you're butchering or whatever, you're like, no, I never touched, I don't do anything. I always wash my hands. Still.
Yep.
It just I got an itch.
Yep.
An itch, and then that's it.
Yep.
Just because you handled mad cow.
Yep.
Crazy, man.
So again, initial symptoms of the variant CJD, the initial symptoms is usually going to be psychiatric problems, so behavioral changes and then painful sensations, while the later stages involve more like the poor coordination, dementia, involuntary movements, the other types of neurodegenerative symptoms that we were talking about before with the normal CJD. So the diagnosis of variant CJD can be suspected based on the criteria and confirmed with a brain biopsy. So the treatment pretty much is just supportive care. Like we said, there's no real cure, okay? And you're going to kind of see a common trend with the other ones is that treatment is pretty much supportive care. As of 1990, there's been 178, way too many, recorded cases of variant CJD in the United Kingdom due to 1990's outbreak, with 50 cases reported in the rest of the world. So I don't know what's going on over there. Because the rest of the world, we got 50 cases. But in the United Kingdom, we got 178. I understand that there was an outbreak of this situation.
Yeah.
But
Yeah.
I don't know if I'm going to be eating beef over there. I don't know. I'm just not.
And we got several, like a pretty good amount of UK listeners. So weigh in, guys. Like, I mean,
I'll have dinner with you. I'm just not getting the burger. No. No. I'll share an appetizer with you. Maybe not even.
oh my God. I can't even.
I'm going to bring my own food to the restaurant.
You'll do the fish and chips.
Yeah, I'll do the fish and
how
chips.
stereotypical is that? You guys are going to hate me. We're going to lose all of our English listeners right now. all of our UK listeners are all like, fuck these Americans somehow.
I know. Everyone already hates us. We love you guys. Okay,
we love
don't
you
hate
guys
us,
though.
okay?
Yeah.
So
Anyway,
just let us be the annoying Americans for a little while.
I know. Well, at least we own up to it, okay?
Yeah, I know. Seriously. And I promise we're like the least of the annoying ones. Okay. I promise. Well, technically we're Cuban. Well, we were born here. We're American. We're American.
We are, but we're not, the white girls picking up possums in the middle of the street type of,
We're about to lose a lot of Americans right now. Anyways.
There's just a hysterical TikTok trend on that. Like how people are like, man, you should not mess with white women because they are not scared of anything.
They pick up possums?
Dude, I'm going to start sending them to you. Yeah, they pick up anything. There's one that, dude, she was drunk off her butt, okay? This chick. Hysterical. She's wearing heels. She just came out from clubbing, right? I don't know what she went to do. Maybe she went to like pop a squat somewhere. And then like, the door was open to the car. The driver was recording this. And she comes back with a full-on possum in her hands. And she's just like, isn't he so cute? And the person, the chick that was like recording it, she's like, you know you're holding a possum, right? And she's like, I know, but he's so cute. Look, he's smiling. And the thing is just like, I'm like, that. I don't know how it didn't bite her. It was probably acting dead because, possums act dead or whatever.
Yeah.
It's like the whole thing. Maybe it was doing that. And she's like, isn't he so cute? And then you just see people stitching it
Oh my God.
all the time of like, don't mess with white women. They're not scared of anything.
Jesus Christ, especially the drunk ones. Especially the drunk
I
ones.
die every time I see those videos. Those stitches are the best. I don't know how we got here, but anyway.
So Gerstmann-Straussler-Schenker syndrome. Okay, so GSS, it is an extremely rare neurodegenerative brain disorder, again, by the Prion. And it typically begins between 35 and 55.
So like now for us.
Yep, you see, we're just starting to compare. Getting old sucks. We're now at risk of Prion's disease.
Talking about getting old.
But I'm like, what could be worse?
I don't know. This is pretty bad. Dude, fuck, I'm recording with my phone. There was a meme that came out. You know the Blink-182 album cover with the nurse, whatever?
Yeah.
And there's like a Blink-182 song of that album like playing. And it was labeled oldies. Like classic rock.
What?
Yes.
That's not an oldie.
It's on my story. For those of you that saw it on my Instagram story, you know what I'm talking about.
Well, that's sad.
We're officially oldies.
Shut up. No, we're not. I'll slap a bitch.
Look at Gen Z, man.
Yeah.
Can you lay off of us? Lay off of us. We're just millennials trying to live our lives.
Yeah.
Okay? We have enough. We
Aren't
can't
they
buy...
busy at Sephora making little smoothie moisturizers?
I don't know. They're doing a lot of weird things in Sephora. Also, stop messing with Sephora, guys. Like,
Yeah, I know.
Come on.
That's our land.
I know. We need it more than you guys. Like, chill. Anyway, wow.
Anyways, all right. So GSS, it typically occurs again between 35 and 55, and it's characterized by symptoms, again, that neurodegenerative type of symptoms. So ataxia, lack of muscle coordination, dementia, dysarthria as well, which just means slurred speech. Nystagmus, it's kind of when your eyes beat from side to side or up and down. You can have spasticity of your muscles, so that's when they tense up, okay? And then also you can have visual disturbances and even deafness, okay? So as the disease progresses, the patients may experience severe disabilities, ultimately death, and often having complications just like aspiration pneumonias. And that's all just because, they can't cough, they can't really get rid of an infection like we can. So anyways, GSS belongs to the group of the prions, which also includes CJD, Kuru, which we're going to talk about in a little bit, and then also familial insomnia, which we're going to talk about next. And then again, no treatment, supportive care, kind of just making you as comfortable as possible. Okay?
For your inevitable death.
Promise this podcast is funny sometimes. So, I don't know how we bounce back from
Blame our ADHD.
It's like extremes here. We're like, ha 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 ha. Mad cow, and then we're like, until you're dead.
Thank you, ADHD. Unmedicated. And that's how.
So surprised with us.
sometimes. We just have to look at ourselves and still be impressed. And we're impressed at ourselves being able to do such dynamic, complex things like that.
Yeah, I know. I think we're just jaded.
Yeah, that's 100% it. That was
Yeah.
me talking shit, but that's exactly
We're
it.
just jaded.
Exactly.
We're like, oh, yeah, that sucks.
Yeah, it sucks. Well, next.
I know. Anyways,
Anyways, familial. Your
Yes.
favorite one.
yeah. Okay, so this one just sucks. Okay, this is like pretty much
I
terrible.
mean, it sucks so bad that Netflix jumped on it, so that's how bad it sucks.
So fatal familial insomnia. So this is super rare too, and it can be genetic, so it can be passed down by family. Basically, it affects the thalamus mainly, and it's the part of the brain responsible for regulating your sleep-wake cycles. So familial fatal insomnia or fatal familial insomnia is classified again as a prion disease. So it does it does land under that subcategory. So it's caused by the mutation in the PRNP gene. Okay, so this leads to that misfolding of proteins that builds up in the thalamus and then starts affecting what the thalamus is supposed to be doing. Okay, so
Part of it is sleep.
which part of it is sleep. It has a lot more functions, but part of it is sleep as well. Okay.
yeah.
So symptoms, hallmark symptoms.
I didn't go into the brain.
No, thank
Aren't
God.
you proud of me?
No, I'm very proud of her.
I could have.
lost my mind, my brain.
This
if I
was a
thought that.
perfect avenue for me to take.
No. Put down the netters. Put down the netters. I don't need another cortex conversation. Okay. Terrible. Okay. So the hallmark symptom is obviously insomnia, and it starts gradually and then worsens over time, and then to the point where you just don't sleep. Okay. So psychiatric symptoms, obviously, if you're not sleeping, you're not gonna act like a normal human. So it includes panic attacks, paranoia, and phobias. You can have physical symptoms such as weight loss, high blood pressure, excessive sweating, and double vision. Again, you're not resting at all. So you just keep going and going and going and going and going, and there's literally no resting. Okay. So neurological symptoms, again, you can have the ones that we kind of mentioned before. So ataxia, the muscle movements. You can have hallucinations, delirium, obviously. You're not sleeping, right?
Yeah.
So you're going to be delirious, okay? And then difficulty swallowing as well. So diagnosis and treatment. So diagnosis, you can do by genetic testing. You can do spinal fluid analysis as well. You can even do sleep studies. That's only going to aid in the diagnosis of all these things, especially for this one in particular with the sleep study, just because you are having insomnia. And then the treatment is pretty much, again, supportive care, okay? I wish there was something that we had a cure for, but we don't so far for prions.
At least not for this episode.
Yeah.
This whole episode, yeah.
Yeah. And the therapeutic approaches, can include vitamins, supplements, balanced diets, sedatives, and antipsychotics, melatonin. All of this, they're just throwing it at you so that we can see if we can get you to sleep, even the most minimal amount.
Yeah, hoping something sticks.
Yeah.
Pretty much at that point. And they're throwing at you the everything but the kitchen sink.
Yeah.
And hoping something helps,
Exactly.
To sleep a little bit, because obviously sleep will help you against all this hallucination, paranoia, everything that we just mentioned. Because I mean, just think about the most tired, the most sleep deprived you have ever been times like 100.
Yeah.
That's what this is. Mm-hmm. And it's like, I'm trying to think of that too. And it's like when Amar was a baby, there was a time that I felt like, thankfully, I wasn't holding him or anything. Like I had put him back to sleep. He had woken up. I put him back to sleep in his room. I was walking back to my room. I fell. I was that exhausted. I hadn't slept in I don't know how long. I fell. Just, I don't know if it was that I fainted or what it was. I just fell. Maya was like, what happened? I'm like, I honestly don't know. So it's just like, it will happen. It's just without sleep,
Yeah.
everything goes wrong.
Yeah.
Honestly.
Terrible.
Yeah. Awful. Nightmarish.
Man, like people when they are delirious and they start talking so much stuff, imagine the person having conversations with these people.
That's what I'm saying. It must be incomprehensible.
I would tell them don't talk to me. I'm afraid I'm going to tell you something weird.
You more than likely will.
Tell you all my secrets.
Oh my God. Or you're creating already at that point, you're just delirious.
Yeah,
You're just-
hallucinations.
yeah.
Yeah. Oh my goodness. Terrible.
Horrible.
Awful. All right. So when does it typically present? So usually between 40 and 60. Symptoms are pretty rapid with this one. And then again, it's life-threatening. It's fatal. It's in the name. But yeah, basically within 6 months to 3 years of symptom onset is usually when we see that progression happen.
It makes sense that it's fast. It's like you're not sleeping.
Yeah. And then because of its genetic nature, it affects approximately 1 to 2 per million globally and around 50 to 70 families worldwide carrying the mutation associated with the condition.
So I know we had briefly talked about that the last time. If you knew you had that gene,
That's it.
right? Yeah, me too. No more. It ends with me. That gene is not moving forward.
Yeah.
I agree. I mean, it's a controversial topic.
Yeah.
I get it. Dude, I wouldn't pass that gene on. Like,
Yeah, and there's just so many like genetic advancements nowadays that like you can potentially
eliminate it maybe.
eliminate it potentially.
But if you can't,
yeah,
no.
exactly.
No. Forget it. Adopt or whatever.
Same
like
thing with Huntington's.
Exactly.
Like, you know.
So many of those. Yeah. Yeah, 100%.
All right, you want to talk about Kuru?
Yes. You know me and my morbid self. So
This one's morbid.
I know, that's why.
How about it, girl? All you.
I'm already making a list of topics to talk about in October. We're going to have a great time.
Jesus.
Anyway, so Kuru, okay? It's a rare and, of course, incurable, like all of these, and fatal neurodegenerative disorder that was prevalent amongst the 4 people of Papua New Guinea. And it's classified as a transmissible, the spongiform encephalopathy. Did I say it? Okay.
Encephalopathy.
That, it's the same. And is caused by an accumulation of the prion proteins in the brain. So the disease was first officially reported in the 1950s, with unofficial accounts dating back to the early 1900s. Kuru primarily affected the 4A women. I'm going to say 4A because 4 doesn't sound, but whatever. And was initially believed to be a psychosomatic condition related to sorcery practices, because if it has anything to do with women, of course, witch.
Yeah.
You're a witch. Whatever. And obviously, it's not the case. The disease was characterized by progressive cerebral ataxia, so like problems moving, leading to loss of coordination and muscle control. Kuru had a long incubation period ranging from 10 to over 50 years. That this thing is just living inside of you and manifesting no symptoms, nothing. You have no clue you have it. And then eventually the symptoms progressing through distinct stages: ambulant, sedentary.
Sedentary?
Yeah. You know, I have to find the weirdest way of pronouncing something and then say it. And then, exactly. And terminal. The epidemic of Kuru declined sharply after half a century, with the last known cases reported around 2005 and 2009. So not too far back.
I've still got a 50-year incubation period, so
Yeah.
we're not in the clear. We're halfway there.
We're definitely not. Researchers discovered a naturally occurring variant of a prion protein linked to Kuru in the affected population, providing insights into related prion diseases like CJD and Alzheimer's disease, actually. So the 4A people of Papua New Guinea primarily contracted Kuru through the practice of ritualistic cannibalism. Yes, cannibalism. During funeral rites. So it's part of their culture to do this. We're not judging anyone. This is a culture thing, but that's how it happened.
Are we not?
It's what happened.
Anyways.
They figured out that that's how it happened. The good thing is that, you know, they moved on from that. So, you know, they figured out this is what happened, and then, you know. But particularly what happened in these funeral rites, and why this was, you know, becoming a problem, is because they consumed the brain tissue of deceased family members in these funeral rites. So, and then if you consume the brain of somebody that has Kuru, then you get Kuru, and everyone around that eats the brain of that person in this cannibalistic practice will get Kuru. And so the brain tissue from individuals with Kuru was highly infectious, because you're getting it straight from the source, the brain. And the disease could be transmitted through ingestion or even contact with open wounds or sores containing prions. So even if these people were not actively eating the brain, but they, for whatever reason, and
handled
it, came in contact with it, and they just so happened to have a paper cut, I don't know, the smallest little thing. There you go. Horrible. The disease was more prevalent among women and children who traditionally consumed the brain, which had a high concentration of infectious prions. Because, of course, you know, yes, like we said, the prions will be all over the body, but mainly is going to be in the brain, you know? So the epidemic accrual began when a villager developed sporadic CJD and died, leading to the spread of the disease through the consumption of infected brains within the community. While the practice of cannibalism has ceased, so you see, like, you know, they figured it out, then they stopped it, or so it's reported, has ceased among the Foray people since the early 1960s. Kuru remains a significant historical example that has contributed to our understanding of prion diseases and their transmission mechanisms. And then Scrappy, yeah, is a fatal degenerative disease that affects the nervous system of sheep and goats. It is classified as a TSC, as all of these are, and they're similar to the diseases of CJD in humans and mad cow in cattle. Scrapie is caused by the misfolding of the prion, the same thing. It goes into the brain and other tissue. And then typically it manifests with the same type of symptoms, you know, the ataxia, the tremors, the incoordination, you know, all those things. So the affected animals may also exhibit like behavioral changes and like a lot of scratching. They'll lose their wool and even lesions on the skin. As the disease progresses, sheep may experience weight loss, anorexia, lethargy.
Yeah, lethargy.
And eventually death. And scurvy has been documented for centuries in Western Europe and is found worldwide except in Australia and New Zealand. And they do have the best meat, like at least with venison. It's like delicious. Like New Zealand venison is out of this world. Anyway, there are two forms of scrapie, classical scrapie and atypical. So the classical affects sheep of all ages and can be transmitted both vertically and horizontally, which means from one sheep to another or birth. That's pretty much what it means. Atypical scrapie is a spontaneous prion disease that affects individual animals. Currently, there's no treatment available for these infected animals, and diagnosis involves post-mortem examination to detect the accumulation of these prions in the central nervous system. Prevention strategies include genetic testing to identify resistant animals for breeding purposes. And national programs like the National Scrapie Plan in the UK, we're back in the UK, aim to reduce the incidence of scrapie by promoting breeding from genetically resistant sheep, which is one of the reasons why, like, if you go out there hunting, you're risking it a little more because you have no idea.
Yeah.
Versus, like, if you get it from a farm, they're more like, yeah, we're breeding it, we're keeping an eye on these animals, like, we know what's going on.
Not
at
in
least
the UK,
potentially.
though.
Yeah, that's why I said not, at least
just kidding.
potentially.
I'm just kidding.
Please don't hate us. Yeah. This is just what it's saying. Like all my research,
I'm gonna look at where the meat is from.
Australia, New Zealand.
Yeah, exactly. That's what I'm gonna go for. All right. So chronic wasting disease.
This one has been in the news.
Yeah, this one's been on the news. We kind of covered it on one of our monthly recaps. So again, it's a prion disease as well. Affects deer, elk, moose, and the other cervids.
Elk is so good. Have you had elk?
I think I've had deer, but not elk.
Elk is like superior. It's ridiculous. It's my favorite. Like if there's elk, I'm having it.
Oh,
it's so good. Okay, my mouth is watering.
wow, that good.
It's so good. It's like soft and it's just like, it's amazing.
I'm like,
elk is like, yeah, it's so fucking good.
try elk.
It's so good. We used to get it when we were in Texas. We would order it from a farm, like a local farm that you know would breed elk and whatever.
Interesting.
So good. And you could, I mean, we're here in Miami, you could order from there. They send it to you like in this pack with like the dry ice and everything. It's like legit. It's awesome.
Oh.
Yeah.
You're gonna have to send me that. I want to try it.
Yeah. Anyway.
All right. So these
The
abnormal
best time to
prions,
talk about
again, it's the protein accumulation. It causes
I'm not quoting them, okay? I didn't even say their name or anything because we're talking about prion diseases. And that's not a good look for any farm. So I'm not going to say their name or anything. So I'll share it with you off camera.
Okay, cool. All right. So again, abnormal proteins, all right, in the brain. Okay. And then the chronic wasting disease was first recognized in Colorado in 1967 and has since been detected in various U.S. states, as well as Canadian, Korea, and I meant to say Canadian provinces, not Canadian. So Canada, Korea, Norway. Okay. So transmission is usually between animals through contaminated body fluids. So that could be poop, feces, saliva, urine, and other bodily fluids like blood. Infected animals may not show signs of the disease until later stages. So you might not know if they're infected or not. And again, symptoms, affected animals may exhibit weight loss, lethargy, drooping ears, excessive salivation, urination, and also loss of fear of people. So that might be a neurological sign for them.
So it wasn't just a lucky shot, maybe.
Yeah,
Like, that's the
exactly.
scary thing about it.
Yeah.
At least to me, as a like hunting, that's what freaks me out. Yeah.
Yeah.
Not
And
that I've
then,
gone hunting, but whatever. It's still whatever. Continue.
okay. And in advanced stages, they may have poor balance, coordination issues, and difficulty swallowing. So diagnosis, it can, be clinical manifestations that you can diagnose, but the weight loss over the weeks or the month, behavioral changes, excessive salivation, everything that I just said. And also, this one we didn't mention, head tremors. So if you see a deer, it's like, you shouldn't go near it. Okay. I would not go near a deer anyways if it did that to me. I'd be scared. I'd be like, what is it doing?
Oh my god.
What is it doing? Is that its sign to like come and attack me? Is that its sign for his whole entire clan to come and gang up on me?
Oh my god. No, but these deer, like, at least in the later stages of this disease, they look like zombies.
Well,
They
yeah,
look
I know. We
fucked
saw.
up.
Yeah, no. I mean, they're like very wasted.
Yeah,
And
but
wasted as in like skinny, not wasted.
maybe it's a good thing we re-recorded this episode.
Okay, I'm gonna stop. Okay. So geographic spread. Okay, chronic wasting disease has spread significantly since discovery, so it does pose a threat to wildlife management due to its impact on the cervid populations. It is concerning, again, to wildlife populations just because it's potential risk to be associated like with humans, But while there is limited evidence of transmission to humans, ongoing research is needed to monitor the possibility. Okay?
Yeah.
So again, just wrapping up like the symptoms of prions. It's rapid.
Yeah.
Neurodegenerative symptoms that we mentioned. That can include personality changes, the muscles, the confusion, the fatigue.
Yeah.
It's fatal. Okay.
Think about it like this, like your brain is involved with everything. So
Yeah.
everything that's involved with the brain is going to be
It's
negatively
going to be
affected.
affected. And then the diagnosis, again, you can do clinical evaluations, you can do laboratory testing. Usually that happens post-mortem. But yeah, so the clinical evaluation, they're obviously going to do a neurological exam on you. And then obviously if they're probably going to run plenty of tests, but if those come back negative, then that's probably going to be the next step. Yeah. So lab tests. So we kind of already mentioned this just a little bit. CSF fluid, so cerebral spinal fluid. It's basically, they just give you a little lumbar tap. Okay. And then a little tap. But they're going to test for specific proteins like 1433 and the total tau levels. So tau are the tau proteins. That's the misfolded proteins. And then they're going to measure those levels in the CSF and see if that gives them any valuable information. So real-time quaking-induced conversion, basically this test just detects the abnormal proteins again.
In that
And it's
fluid.
only, okay.
Yeah.
And then genetic testing. So obviously if you have some sort of family history, then you should do genetic testing. Okay.
Exactly.
And then imaging, MRI, PET, CT scans, it's going to reveal characteristic changes of the brain with prion disease. And then you can also have EEG to measure, your brain waves and then make sure it doesn't show any abnormal waves that may be indicative of prion disease. And then obviously brain biopsy. So
Obviously post-mortem.
yes, postmortem. Okay. So a definitive diagnosis of prion diseases is typically confirmed through brain biopsy or examination of the brain tissue post-mortem to detect the accumulation of the abnormal prion proteins. You can have a brain biopsy though, like live.
Right. But like I'm thinking of like
But not
I was thinking of like full on like removing the brain from the skull type
no.
of like
No.
situation. That's what I was thinking.
Yeah. To be honest, I'm not sure. I mean, prions are so rare. I wouldn't know if they do this just only.
That's what I'm saying. Like I feel like at least for the deer one that I've seen like in the news and whatever, like the post-mortem examinations, it's like when they remove the brain and then they like test it or whatever, they slice it and they put, all that shit. So that's why I'm like, oh, okay. But I mean, for humans, I'm not sure. Yeah, probably it's just like a little biopsy. You could definitely do that while you're still alive.
Yeah. And then while there's no diagnostic tests for live animals and humans to detect prion disease with certainty,
Advancements in research aim to do just that.
Well, that kind of answers that.
Yeah. Yeah.
There you go.
Yeah, I think when they do the testing for the biopsy, it's really to see the tau protein.
Yeah, it's got to be.
It's, because you can tell, like, you'll see specific changes on an MRI and a PET scan and stuff like that. So if you're seeing it, if it's like walks like a duck, quacks like a duck, it's a duck.
It's a fucking duck, bro.
So that's kind of same situation here.
Absolutely.
And then treatment,
Yeah. So the treatment, like we said, just supportive, palliative, just trying to make you comfortable for the inevitable death. So there's no specific therapy even. It's just really person per person, case per case. Like, how is that person developing this disease, this neurodegenerative progression, pretty much. It's very debilitating in nature. So that's why it's like, any assistance with daily activities, making sure that you're hydrated, because you're going to lose, or you have the potential of losing your ability to even swallow. So maybe you're going to have to go into an IV type of situation, all those things, that's where you have to like make sure that you're covering that for the later stage for these patients. And then of course the muscle spasms, psychological issues, pain, all those things. And then there are therapies like anti-prion antibodies and RNA interface, and so RNAi. And these treatments are still in their investigational stage, and they're not yet established as standard of care. So there's, like I said, a lot of research going into this, but none of it has been like just as, what is that called? The gold standard, right?
Yeah.
None of that's not there yet at all. So the complexity of prion diseases and their rarity and the challenges associated with targeting abnormal prion proteins makes finding actual effective treatments a challenge, because everybody's different and everything manifests in a very different way. And like we saw, some of these take years for them to even manifest, So some of the risk factors: acquired prion disease. These ones are caused by exposure to the actual abnormal prion protein, and the risk factors by acquiring prion disease through contaminated food or medical equipment are extremely low due to strict regulations and precautions. But like she had said earlier, years ago, it wasn't that strict. We're talking about maybe 50 to 100 years ago. Not the case. So maybe that's how it was, at least back then. However, people with a history of or risk for exposure to prion disease should avoid donating blood or other tissues, and medical instruments that have come into contact with nervous tissue of someone with a prion disease should be just destroyed at this point, because they're very, very hard to you can't really just clean them off.
Yeah.
They're extremely hard to get rid of. So just get rid of the actual instrument at that point. Genetic prion diseases, they're caused by the mutation of the prion protein. That's pretty much it. The risk factor for developing genetic prion disease includes inheriting it. Wow. An altered gene from one affected parent, or a new mutation in the gene. And that's sporadic. This just happens. Like, we're not really sure. The risk factors are unknown. It's just idiopathic. Like, you're not really sure why. It just happens. Lastly, prevalence.
Yeah. So prevalence is basically how common or how often you're going to see that. So the prevalence of prion disease is, in general, the population is approximately 1 to 2 cases per million worldwide. Unless you live in the UK, that might be a little bit higher. I'm just kidding. I'm kidding. I had to, though. But I'm kidding. Anyways, it is 1 to 2 cases per million worldwide, because that's the prevalence. Okay. But the most common form of human prion disease is going to be sporadic CJD. Okay. And then that affects 1 to 1.5, 1.5 people. I don't know where that half came from, but 1 to 1.5, just half of someone. People per million.
You know how statistics is,
exactly.
And it's a bitch, and I hated statistics. I rather, back then in FIU, I rather take calculus over statistics. That's how much I hated it. And I hated calculus with a passion, but statistics? Get the fuck out of here. Anyway. Wow.
That's our episode.
That's prion diseases. I hope this, scared
Julie
you.
hates statistics just as much as I hate physics, but she loves physics.
I don't love physics, but I get it.
Loved physics.
No, but I get it.
But she hates stats.
I hate stats. I hate it. The way that it's calculated and...
But stats is the way that math is calculated, or how you get stats. That's what you told me about physics. It's the way, things happen.
Whatever, man. Okay. Here we are.
I hated stats too.
it's just whatever. Anyway, hope you guys liked it. Thank you, Patreons. You guys were awesome. And we'll see you on the next one.
Bye.
Bye.
Like, comment, review us on all streaming platforms, Spotify, Apple Music, Amazon Music, etc.
Check us out on Instagram and TikTok at Funny Medicine Podcast. Our Gmail is funnymedicine305@gmail.com. And remember, we are not diagnosing you.
Definitely not. Just funny stuff.
See you later, guys.